The only way a placenta comes out first is something called a placenta previa. The likelihood of having a placenta previa where you're dilating and delivering without having like massive bleeding, like will kill you and or baby bleeding, is, well, that doesn't happen. Like a placenta previa, unless you just like started dilating and immediately delivered, there's no way to do that without everybody just bleeding a whole lot. And the reason is because when a placenta overlays the cervix, that's called a placenta previa. So the placenta, here's your cervix, this is the part that goes into the vagina, this is the part that goes into the uterus. Uterus is here. If placenta is like this, that's called a placenta previa. As the cervix starts to dilate like that, if the placenta is attached here and those vessels are attached to the top of it, as that dilation occurs, then those vessels where the placenta has grown into the uterus are actually grown into the cervix at this point, and they break. And the more dilated you get, the more of those vessels break. And when that happens, you just have worse and worse bleeding. This is also progressively disrupting how much of the placenta is attached to the actual uterus to exchange blood flow for the baby. So the more dilated you get, not only the more blood are you losing from a hemorrhage, but the less oxygenated blood is getting back to the baby. So I'm sure that it has been described of someone laboring and delivering successfully with a placenta previa, but this isn't just like, oh, there was a study that said breech birth is dangerous and, but sometimes it can be not dangerous. Placenta previa is never a vaginal delivery safe thing. So, and I can't think of a way that you would ever be delivering the placenta first, except that. I mean, that's the only way that happens. But, well, no, you can't move the placenta out of the way. You have to do a cesarean. An abruption, the difference between an abruption and a previa, they're essentially the same thing, but a abruption is when the placenta is coming off the side of the uterus and it's not covering the cervix. So abruption, I guess, is kind of the same thing. It's bleeding from disrupted connections of the placenta to the uterus, but it's not covering the cervix. So it's not, previa is scarier in, I don't know, they both can be really horrific, but a previa is alarming because there's an ongoing process that's continually going to disrupt those vessels. And abruption is usually like a singular event, like a car accident or an injury or just a spontaneous event. But the cervix continually dilating is just disrupting more and more and more. And then you can't get anything out until the placenta fully delivers, which means there's no blood flow because the placenta can't come out until there's no blood flow to the baby. And yeah, I do want to say, like, in real life, usually placenta previa is manageable because if somebody starts bleeding, then we would deliver. But this is a situation that we've talked about a little bit in regards to someone who has a previa and has a bit of dilation and is hemorrhaging and has a baby that's not viable yet. And with regards to things like abortion laws, what does that mean? And this is a situation that could be really dangerous. I mean, you can bleed very quickly. The uterine arteries, which come into the side of the uterus, in a pregnant uterus, deliver 500 milliliters of blood per minute to the uterus. So active rapid hemorrhage means you're losing your entire blood volume fairly quickly if there's some kind of situation that's not being intervened upon. That sounds like a lot. Doesn't the human body only have like 5 or 6 liters of blood? Yeah, I think the average non-pregnant volume is like 5 liters and 6 liters in pregnancy. Your blood volume and your plasma volume increase in pregnancy. Someone said, let me look at questions. Does a placenta stay in one spot? I'm 29 weeks, have an anterior placenta. They stay in one spot, but sometimes when a placenta is called a previa at 20 weeks, actually more often than not, if you get a ultrasound at 20 weeks and it's a placenta previa, more often than not, it will not cover the cervix anymore by the end of the pregnancy. But you wouldn't have an anterior placenta and then it suddenly like move down and become a previa. Let me explain why. Previa means it's overlying the cervix, but at 20 weeks, if the cervix is here and the placenta is here and it's overlying it like that, as the uterus grows, because the placenta stays where it's implanted, the uterus grows, the placenta can move up away from the cervix. but you'd never have a situation where one that was implanted well away from the cervix suddenly was covering it, if that makes sense. So it doesn't actually move, but the uterus gets bigger and the distance between the uterus and the placenta can increase. And a partial previa is very different than a complete previa. I mean, both require a cesarean to safely deliver, but usually if you have a complete previa, especially if you've had any bleeding, you're going to need to be real close to a hospital for your whole pregnancy. Is it possible to catch blood loss if it's coming out of a known source and use it as a feed back into the body? Yeah, that's called cell saver, and it's commonly utilized for people who are Jehovah's Witness or have another reason that they would not accept a blood transfusion if they are expected to have a delivery that is a surgery or something that could result in massive blood loss. It is a bit harder to use in pregnancy because blood is combined with amniotic fluid and all kinds of stuff, but it can be used in pregnancy as well. Wouldn't that blood be dirty? Yeah, so it doesn't go right back into somebody. So this is what the machine looks like. So see all of these things in here. It's got lots of technology for it. And I'll show you there's a good article, on Science Direct. And the blood is collected and washed with normal saline, then concentrated to make a unit of blood, which includes a certain percentage of red blood cells, and then it can be stored, and it's not immediately fed right back into the patient, and it's also cleaned, to my understanding. But I am absolutely not a hematologist. Here we go. So used in many surgical specialties, particularly for patients who are Jehovah's Witness or otherwise would refuse to have a blood transfusion. Increasingly used around the world with 400 case reports in the literature. And then I was hoping that would talk a little bit more about how it works, because I'm not actually 100% sure what the process of cleaning it is. So sectioned to a reservoir with heparinized saline, which is to keep it from clotting, into the cell saver machine, washed with saline. There's probably some sort of really advanced filtration technique that's used, especially in obstetrics. There would have to be.